Hi everyone, thank you for coming. My name is Kara. I am a senior biology major. In this past November, I had the amazing opportunity to travel to Cusco, Peru for 3 weeks with my good friend, Maria Davis, who's in the crowd tonight. And we participated in a healthcare volunteer experience. So upon graduation, I'm really interested in pursuing a career in women's reproductive health. And so I thought this would be a wonderful experience to learn about the healthcare field and really gain insight into a different culture and their healthcare system. So here's just a brief overview of my program. I decided to volunteer through the International Volunteer Headquarters and their partner organization, Maximo Nivel. And you can see there on the map, Cusco, Peru is the place that I volunteered in. During my stay there, I stayed with a Peruvian host family, along with 5 or 6 other volunteers who were doing various volunteer projects, and they were from all around the world. So it was really great to talk to them about their experiences. So during my 3 weeks at my volunteer placement, I worked at the Choco Health Clinic, which is pictured here. And this is an understaffed, under-resourced clinic that's located on the outskirts of Cusco, Peru. And so they really cater to low-income families in that area. And here I just have some pictures of what the clinic looked like inside. It was really small, really tight quarters. So on the top left is the picture of the laboratory, and you can see the microscope. That was pretty much the most advanced equipment that they had there, which was really crazy. The 2 right pictures were of the pediatric room, and there are some nurses copying down some forms. And then this bottom left picture was essentially their filing system. There was only 1 computer in the entire clinic, and so they had to copy everything by hand. So that was extremely different from what we see in the United States. So during my 3 weeks, I spent the majority of time as observing and shadowing physicians. Again, I'm interested in women's reproductive health, and so I spent the majority of my time with Isabel, who was the OBGYN in the clinic. And I also shadowed Marco, who was the laboratory technician, and a couple of the nurses who worked in the pediatric department. Prior to this experience, I had no Spanish experience whatsoever. And so this was definitely one of the most challenging aspects of my volunteer experience. So in order to effectively communicate with physicians and patients, I studied medical terminology. Maria and I would bring 3, 4 Spanish-English dictionaries to work with us every day. We'd act out things if it got really tough. So by the end of the program, I was definitely able to have a somewhat decent conversation with physicians and talk about deeper issues like women's reproductive health issues in the area, government involvement, things like that. So that was really cool. I'm a pre-med student, so I don't have a lot of experience in the healthcare field, but I was able to assist with basic duties like taking the height and weight of patients. So there's a picture of me weighing and taking the height of a patient. And then I also completed this experience for academic credit. And so I kept daily journals about my interactions with physicians and patients, discussed any questions that I might have come up with during the day. I also conducted 2 interviews with individuals who were working at the clinic. And this was primarily to find out what they liked about their jobs, things that they didn't like about their jobs, their educational background, things like that. And then lastly, I composed a critical review research paper, which I'll briefly talk about in a little bit. So this experience had a huge impact on me. One of the things that I really noticed was the different cultural differences between the US healthcare system and Peruvian healthcare. And so the first thing, as I mentioned before, you guys saw that image of all the files in that bookcase. And so their technology is just way far behind what we have in the United States. Everything was, copied by hand. They had to fill out multiple forms several times. And I think both patients and physicians were much more organized because they had to keep track of these forms. As far as resources and supplies go, there was really a lack of basic resources. Maria and I brought face masks and gloves with us to the clinic because they just didn't have these basic necessities. And when I interviewed Marco, the laboratory technician, he actually said that he could only use 1 pair of gloves per day. And he's someone that's dealing with blood samples and urine samples. And so that's not what we see here in the United States at all. And then lastly, the doctor-patient relationship was really interesting. Isabel, who is the OBGYN, is pictured here, and she would spend between 5 minutes or an hour with patients. And I think that was mostly because she really focused on their patients' emotional needs in addition to their medical needs as well. So as a potential healthcare provider, I recognize that I'm going to be working with people who have different cultural backgrounds than me. And so this really provided me with a great experience. I learned about another culture and learned how to appreciate that. From a practical standpoint, I have job shadowed physicians in the past, but not for this length of time. And so it really gave me a lot of experience in the healthcare setting, interacting with both physicians and patients, despite the language barrier. And then I also conducted a research paper about clandestine abortions in Peru and how they're illegal and how is that impacting women's health issues. As far as the future goes, if anything, this just really reinforced my desire to go into healthcare, especially women's reproductive health. And so I would like to actually go back to a developing country, hopefully in medical school, and do some more work in understaffed, under-resourced clinics. So I would just like to thank the Cornell Fellows Program for funding, Craig Tepper, who is my faculty sponsor, Isabel Cornejo, who is my site mentor, and obviously she can't be here because she's doing great work in Peru, and Chelsea Green, who was an IVHQ program coordinator. So thank you.